District, Medicare has become a big issue, especially since Paul Ryan wound up on the Republican ticket. 10,000 people age 65 every day are retiring now. It's going to be happening for the next 20 years. What should be done with Medicare to make sure, well, A, should it be strengthened? Should it be kept? What should it look like? Tony Hernandez.
Number one, if I'm elected to Congress, I would work to ensure that we maintain our commitments to our seniors and those nearing retirement for our Medicare and Social Security commitments. There's a lot of seniors in our district. I've been honored to meet many of them campaigning. And one thing that is clear though, our seniors are starting to see the light. Them, just like everybody else, they realize that we are on an unsustainable fiscal course. And so the best way that I can see put in order to maintain these commitments to our seniors is to get more people working, to grow the economy and get more people paying into our system. That way we'll have prosperity and health care for all.
Betty McCollum.
I'll answer the question, but I don't think I'd like to hear some concrete examples on how you think we should reform and change the system. But, you know, Medicare is a promise we made to our elders. And it's a promise we made to our elders because they couldn't get health insurance. The insurance companies weren't beating down the doors, folks, to insure our grandparents and our great aunts and uncles that had 5 chronic conditions. 5 chronic conditions, and that the health insurance companies aren't clamoring and coming up with policies under Paul Ryan's plan to say, yes, we can do it for this amount of money. What Paul Ryan and what I've been fighting against is turning it into a voucher. That voucher for a family can mean thousands and thousands and thousands of dollars of out-of-pocket expenses. Where's that money going to come from? Where is that money going to come from a senior on a fixed income? Now, what is in the Affordable Care Act are ways in which we start working to help seniors reduce costs by getting in and doing the preventive checks that Steve and I talked about earlier, getting in and making sure that they don't fall into the donut hole, so they stop taking their prescription drugs and start a cycle where their health goes down and then they come back into the system and they're more expensive, and cutting out the waste, fraud, and abuse. And I'm going to give President Bush a lot of credit for this. President Bush started looking at the end of his term on what to do about Medicare fraud. You know, a lot of the drug cartels in Florida were getting out of drug running and going into Medicare fraud, and we didn't have any inspectors and IRS agents and police and the rest working on it. We have started to clear that up, and we've also started to crack down on insurance companies who were taking money from the federal government and providing no insurance to seniors.
Steve, quickly on this one.
What is in the Obamacare is rating Medicare for $715 billion to further weaken the promise to the seniors. What this question is about is how can we save Medicare, provide for future generations? How can we maintain trust in government when these people have paid in, and like Betty said, this isn't something that can be easily solved through working with health insurance companies. And how committed is America to aging with dignity? We all want to age. Now, that said, you cannot have any Social Security or Medicare retirement system unless you have children being born, growing up, raising families. The population is supposed to expand, and that's how you support people, and it's a great concept. But for many people under 55, this hasn't been happening. Abortion on demand, okay, lifestyle choices, people just living from wage to wage. It's not setting up a society which can meet that commitment. So, for those under 55, we're going to have to look at that. Do I support a voucher system? I think that people should be able to offer products, but I don't think people should be required to go to voucher systems. And if we need to kick in more money from the federal treasury, maybe there's from year to year, decade to decade, we're going to have to do that. But ultimately, we've got to get back on track to be able to have a retirement society.
Tony Hernandez.
Just to answer Representative McCollum's question, means testing, I think, is a very smart reform that we can initiate. I've talked to many seniors that are very well off, that have a nice pension, they have millions of dollars in assets. We don't need to give them the full Medicare benefits that a senior who has less money and less resources would perhaps need in order to survive. So that's just one area I think that would make a lot of sense. Eventually, we may need to talk about increasing the age as well.
What about the Ryan plan, though, to go for people 55 and under with a voucher system in addition to traditional Medicare?
You know, it's my generation that's going to have to reform Medicare and get some of these programs back on track. And I happen to believe that the surest and best way to ensure that these programs are funded is through a healthy, strong, viable economy, getting the people who are able to work to be working. That being said, I haven't signed on to the Ryan plan or the voucher plan. I think that as an individual, as a younger American, I want to have choices. I don't want to be forced by the federal government to get into this plan or that plan. I want to be able to choose what plans I have for my own self and my own family.